At EHA this year, we're presenting the preliminary results of the first-in-human trial of CC-93269, which is an IgG1-based T-cell engager that has two domains against BCMA and one domain that binds to CD3. There's a higher affinity for BCMA and a lower affinity for CD3, which should give greater specificity for the target and less of a non-specific T-cell activation. Because of the IgG-based structure of the molecule, that also gives IgG-like pharmacokinetics and therefore a longer half-life, allowing less frequent administration. So this was a first-in-human dose-finding study. The study is still ongoing. At this point, we have, however, reached a dose level, between 6 and 10 milligrams that produces response in most patients. We saw essentially no response on patients that receive up to 3 milligrams. We start seeing responses between 3 and 6 milligrams, and saw most patients respond with a dose of 6 to 10 milligrams. This is a population that's heavily pretreated, with the vast majority of patients being refractory to PIs, to IMiDs, to CD38 monoclonal antibodies, and actually 2/3 of the patients simultaneously refractory to all those classes of agent. The main findings in the terms of toxicity was, as expected, cytokine release syndrome, that in the vast majority of patients was present, but it was grade 1 or grade 2. There was a little bit of cytopenias, mostly neutropenia, that is either self-limited or responsive to growth factor, or just to omission of one or more doses of treatment. Surprisingly, very little in the way of thrombocytopenia. There was about 30% of grade 3 or higher infections. It remains to be seen, I think, across most agents that are finding its way on this later lines of therapy, whether this is a direct effect of the agent or modality of therapy itself, or that reflects mostly of the population. Some of the responses are durable. At the time of data cut, some of the responders were approaching 12 months on therapy, and we look forward to longer follow-up to really learn more about the duration of those responses.